Today we're going to talk about KCUCS pattern analysis. We're going to go through the purpose of the instrument as well as how to get the pattern and how to mark future graphs against the pattern. So the first thing we want to talk about is the elements of subluxation, and this is basic and we know this, but we're going to go through because it pertains to what we'll be looking at with the instrument as well as our spinographs in later sessions. There's two components of the subluxation that are derived from spinograph and two that are derived from the instrument. So as we see, we have the misalignment and the occlusion that's by spinograph, and then we have pressure and interference that we find from the instrument, and this is what we're going to be dealing with right now. B.J. Palmer later added a fifth element to the subluxation. What he talked about is this three-directional torque misalignment. And so what he was talking about here is that the vertebrae in the upper cervical area would misalign in a three-directional torque misalignment that would be a fixed position, and because of this, because of time and staying in this fixed position, it would create a situation of dis-ease. When the same patient displays a persistent and consistent thermography, they are now expressing a condition that B.J. Palmer and we talk about as dis-ease. This is a lack of physiological function and the person's not at ease. And so this is a key philosophical point for us, which the fifth element can then be applied to, because it's this time factor. This long term of dis-ease will lead to functional and pathological findings that will then be called a specific disease, and oftentimes patients will come in with a specific disease, and this is because they've spent a long term in dis-ease to get there. So there's 5 possible kinds of pressure at the occipital and lanal axial region. And so we see these as, this is what B.J. Palmer outlined, and what he talked about was osseous pressure. This is the misalignment of the atlas and axis. He talked about cicatrix pressure. This is what he called scar tissue pressure. This is because of the length of time of misalignment putting pressure on the soft tissue. It would cause a scarring type to the tissue that would then show as a reading that even when the adjustment was made, the reading may still remain because of this change in the soft tissue. Meningeal torque twist. Of course, he's talking about there the meninges and the fibers like the dura mater and the other fibers surrounding the nerve system that are torqued and twisted because of the misalignment. There's also an inflammatory pressure that occurs whenever there's interference at this area, also causing pressure to the circulatory system with the upper cervical arteries and veins, and the plial plexus of arteries and veins that we'll talk about in the medullary lock. Also, spinal cord shrinkage, that after a period of time of interference that is damaging to the circulatory system, then there will be spinal cord shrinkage over time. B.J. Palmer talked about different things that would be revealed by thermography. He said when the subluxation is present. Of course, that's very important to know. when it has been corrected. And so when we want to see that it's there, we want to see that the job's been done, or if it has not been done and it has not been corrected, it's important to know. We want to know when to adjust. When the person's in pattern, they need to be adjusted, or sometimes they may have symptoms yet not need to be adjusted at that time, and that's important to know. This will help a patient get well quicker if you can resist adjusting at a time when they do not need it, and when adjusting should be stopped. Sometimes we make an adjustment and a day or two later a person still has symptoms, but we see that the reading is clear. We want to stop adjusting and allow them a chance to heal. We want to know if our adjustment was good, if it has been made properly, or if it was not made properly, and that'll also help us in training to help us to make the proper changes to our adjustment so that we can start making better adjustments. When the adjustment was just a push or a shove and an adjustment with the extra something. And finally, when the patient is on the road to recovery, and this is probably the most important. As you're reading your graphs, you'll start to see them continually get better and more straight line readings, and you know the patient is on the road to recovery. What the instrument does is it takes us out of this realm of treatment, and this is what we're looking is to get to what B.J. Palmer and chiropractic philosophy says is correction of cause. And so we want to get out of the realm of treatment and into that realm of cause and allow for the innate healing that needs to take place. An important thing that B.J. talked about was to adjust. This is on page 520 in volume 18. If you have not read this book, this is an awesome book to get to understanding B.J.'s mindset and philosophy behind the upper cervical. To adjust any place at any time when there is no pressure or interference to transmission is to open a field of dangerous practice that would increase the occlusion and increase the pressure. And so we're doing the opposite. If we're doing this here, then what we're doing is the opposite of what we're looking to do. So thereby we're decreasing the transmission and making every such case worse. So when BJ developed the upper cervical care, he was moving us past this position of just adjusting to feel better or adjusting to change symptoms, but to actually see when there's interference to transmission, make a correction, nerve system to flow uninterfered with, and to monitor to make sure that the patient was continuing to do better, realizing that the power within the body is that which heals the body and not the adjustment itself. The adjustment just opens the occlusion, removes the interference, and allows the patient to get better. So of course at that point, if you are adjusting when there is no pressure to or occlusion or interference to the nerve system, then each case can continue to actually get worse by continuing to adjust. B.J. Palmer taught that the temperature differentials were a result of heat resistance buildup causing interference to the mental impulse via subluxation. And so when originally we used a neuroclirometer, which was to see the deflection of an increase in heat at a certain area, later B.J. Palmer determined that it was more important to see the pattern of interference. So what he said was when electricity is inhibited or blocked through a circuit, the energy has to go somewhere. And so since it cannot go where it's designed to go, it dissipates as heat. So BJ thought the temperature differentials resulted from this interference to the normal flow of energy coming through the spine, and it dissipated as heat as a result. Dr. Duff, he is one that Dr. B.J. Palmer mentioned as an excellent chiropractor and verified his work. Dr. Brian Duff, a colleague of ours, did a lot to helping us better understand the pattern analysis that we're going to go through here today. Well, Dr. Duff concurred with B.J. Palmer as to the mechanism and wrote an excellent book. And this book is called Chiropractic Clinical Research Interpretations of Bilateral Skin Temperature Differentials. What Dr. Duff talked about was that heat was a byproduct of energy in motion. Motion is an expression of action. Action in motion caused heat, and the heat would dissipate from greater mass to lesser at right angles. And this is what Dr. Duff believed was what we would read when taking what they took as neurocalligraph readings and what we're using with the Titron. Book, and he talks about, this is an excerpt from his book, talking that it would dissipate from greater mass to lesser mass, move laterally out depending on the resistance. Heat is the vibratory action. This is the dynamic theory of life from Dr. Duff, of molecules. The vibration of the energy that meets resistance is liberated, its energy in the form of heat at right angles. And so these laws of physics apply to the heat loss during the conduction and resistance of electromotive force, and this is what Dr. Duff called the flow of nerve system, the electromotive force through the brainstem and spinal cord. What he found is that plants, when injured, a small rise in temperature was noted where there's no circulation, obviously, in the plant. And so such a rise, he believed, was attributed to the expression of increased metabolic activity at the area of damaged cells. And so he said that this was a portion of what we are reading in our reading as well. No patient in the B.J. Palmer Clinic from 1935 to 1961, having had all types of different diseases, was adjusted below the axis. In Dr. Palmer's practice for 2.5 decades, I've never adjusted a patient beneath axis, nor found the need to do so. Also, I've never, in more than 35,000 comparative full spine temperature differential graphs, so this is not just the upper cervical graphs, but these are full spine graphs as well, found a constant deflection at a constant level below axis. So he didn't find the persistent, consistent pattern below axis. So when the upper cervical area remained clear, then he was not seeing any consistent interference below C2. This is 500,000 graphs were taken in the occipital and atlantal axial region, and this is where he found the consistent, constant pattern that he believed would be the cause of dis-ease and then the cause of diseases to follow. This is from Dr. Duff, and this is what we're going to go through here in just a moment, talking about the constants. And so he'd take two readings and he would see where it was constantly deflecting in the same direction, and then in those areas they'd be marked, and this would be a constant and this would be a constant, and here. And so in this situation there would be 4 constants, and that's what he was looking for. And so then they would patient would write down how things were going, and in this case they had 4 constants. This person had multiple sclerosis, and he had walked with a cane. And so it says here he makes monthly checkups for the first year, after the first year of twice per week. From 1962, he had 85% return to health, no cane, no help, drives, gardens, slight stammer in voice. And because he has had a persistent constant at number 3, which is right here, this is the 3rd constant, then he has made monthly checkups to make sure that the pattern constant was not returning at that point. If the pattern constant and the pattern would return, then another adjustment would be given. Where there's still a constant right there, and that's the one that continues to return right here. And this is another page from one of his books, and these are the readings that he takes, the established patterns and future readings, and we're going to go through our own, but just to show you how Dr. Duff was doing it. And what they were seeing was that there was 5 visible constants in the return of pattern. And so what we're going to be looking for is the constant. So in this, that patient has been symptom free for 11 years and has needed correction 5 times. So they've needed 5 adjustments actually in the last 11 years. The patient has been checked approximately once per month, and so the patient went 6 years between adjustment. Okay, it's important to keep a good history of graph readings to see if the readings are increasing and decreasing in magnitude over time. This is the most important way that we can tell if the patient is improving. Having multiple readings on people show us how they're doing, and it also gets us to know their case more specifically. There's hardly anything worse than to do a thing excellent and not know how it was done because we didn't keep accurate records. And so it's important to keep accurate records for the success of the case, and also for research purposes. If we decide to write a case up for a case study, we want to have accurate records. The graph readings are evaluated on each case on each visit, looking for, again, reproducibility and persistency. So from visit to visit, we'll take a reading. Now, oftentimes, if the reading's all the way clear, we may not run another reading and we'll reschedule another appointment. If the reading is showing some issues within the reading, some constants, then we may have the person rest for 20 to 30 minutes to see if that reading will clear. If the patient is in pattern and we have determined that an adjustment will be made, then we'll make the adjustment. The patient in our office will rest an hour, and after that time they'll come back and we'll take another reading and see if the pattern has cleared. And so they can oftentimes get quite a few readings, sometimes just 1 or 2 readings. Now, when we take the readings, what we're looking for, and this is what we're going to go through here, are deviations that are constant from one reading to the next. And this is how we're going to determine the person's pattern, by reading these constants and then marking them and understanding on future graphs when these constants reproduce themselves, then the person is in pattern. So finding pattern. What we're going to do is on the first few visits, which can be 1 day or 3 days, we want up to 5 readings. And this can be done with 3 readings, but 5 is much better. And so here we have February 28th, February 28th, March 4th, March 4th, and March 9th. So we can see here though at 5:40 and 6:02 that's separated by 22 minutes. Here at 2:26 and 2:37 is 11 minutes. So ideally we want to separate the readings from some time and not just take 2 readings back to back. Now, to mark these, what we're looking for is how these readings are moving from the top down. And so we see there's some movement here, and then it moves from left to the right. And then we see as well this one moves from the left to the right. and this one moves a little bit there and then keeps moving from left to right. The same thing here and here. And so this reading, where it moves from the left to the right, becomes a constant. And so we want to find the first place that the reading changes direction. And so here this comes down, and right there it changes direction. This one will change direction about right there. This one actually doesn't change direction until you get all the way down there. This one will change direction right about there. And this one here. So when we see that and we take our ruler and we run the reading down, we know that this is the highest point where the one reading out of the group of 5 changes direction. And so we're looking for that line to be drawn right here and across all the rest of them. This becomes our pattern angle. It's the pattern constant. And so this is the most important, and so it's important to get this one right and see where it is. So even though the line continues on this one past that point, we're taking the reading where it first of all these 5s, the first one that turns to a different direction. Now to mark the second break, we see that this continues a little bit that way and then it comes in this direction. The same thing is true here. This one goes quite a bit before it turns back the other way. This one is going from right to left, and then this one has a little bit that direction, and then it goes right to left. So they all start going back in the same direction again. So at this point we need to find what the highest point where it turns again, and so this one comes down and right about here. And this one doesn't turn till about here. This one here. This one here. And that one really right about there. So when we see that, this is still probably close to the highest there, and so we can expect our second line to come down to about this point right there. And so then this becomes the second, and when the rest are drawn throughout, we can see this person ends up with 6 constants. So the pattern constant is a constant, and then there's 5 others, and so there's 6 on this patient. Now in subsequent visits, when marking the constants, this is our original pattern, and we had 6 constants. And so when we take the subsequent visits, March 11th, March 14th, March 16th, March 18th, and again on March 18th, we have these readings, and what we're going to do is extend the line from our pattern across to the rest of the readings. So extend them out. Now on this next reading here, we're looking at this break, this constant, pattern constant. Is this reading moving in that same direction? And we can see it is not. It moves straight, and so this is not a constant, and we'll denote that by making 2 dots on either side of the line. And so as we continue to look down, we see here this one moves in this direction, and here it actually also moves in that direction. And so this one actually is a constant, and we denote that with a line straight across there. We have 2 dots when it's not a constant and a line when it is. So here we see this one moves in this direction, this one moves in the opposite direction, so it's not a constant. And we can continue marking down to the rest of, and so we see not a constant, constant, not a constant, not a constant. Down here we actually see that go in the same direction again, where there's a constant, and then the last one is not. So what we're left with is the original reading, and then on March 11th we have 1 and 2 constants. We do not have the pattern constant, but we have 2 others within there. And so in determining, we see is that the reading is C for clear, and that here there are 2 constants out of 6. 2 of 6. That line right through the middle there, this means of. 2 of 6. So there's 6 in the pattern, and that there are 2 of those 6. Now we can also, and many times we may record it this way, that it's clear and that there were 6, and now this stands for this minus sign in between here, right here, stands for the word 2. So this went from 6 constants to today is 2. So we see that this first reading here had 6, now we have 2. So if we look at the next reading and we see this reading has 5 constants, so it has 5 of 6 constants, and it went from the previous reading, which had 2, and now we have 5 constants. So the reading appears to be getting slightly worse, although this top part of the reading is still clear. And then in later classes we'll continue to go through the rest of reading these constants, but the next reading we see clear 2 of 6, or clear 5 in the previous to 2 currently. I look forward to us workshopping some of these ideas and the pattern and the constants. It's important for us to take these bricks of knowledge and add mortar to them and learn in between times. We need to study the pattern analysis, and if we do and we learn how to master taking the readings, reading the readings, we'll be able to deliver the highest level of upper cervical care. Thank you for your time, and look forward to seeing you next time.